Well, about 50 years ago, there was an association shown between dietary fat intake and reduced mortality from breast cancer in observational studies, country-to-country differences. Observational studies subsequently have been very mixed, maybe because the dietary differences aren't great between individuals, and there's been difficulty in measurement, and there's no biomarker for diet. So in 1993, the NIH decided to fund a full-scale outcome study looking at dietary fat intake reduction pattern compared to control in a large population of postmenopausal women who didn't have cancer as primary breast cancer prevention. There were 48,835 postmenopausal women between the ages of 50 and 79. We had bracketed, so we get people in each of those age groups, and randomized to dietary fat intake reduction pattern or a no change control. The people in the dietary group had 18 visits in the first year, group visits between 12 to 16 people monitored by a centrally trained nutritionist, and then quarterly follow-up. And then we were looking at breast cancer as a primary study outcome. The diet focused on reducing dietary fat intake with a target of 20% of calories from fat, from about 30% which they had at entry, increasing fruits and vegetables, increasing grains. There was no target for weight loss or there was no coaching for weight maintenance. And they're equivalently followed with yearly or biannual mammograms as a primary study endpoint. The study was originally reported in 2006 because we had to report it on the basis of follow-up, which was 8.3 years. At that time, out of 1,727 breast cancer cases out of the 48,835 women, there were 9% fewer breast cancers in the dietary group. The p-value was 0.07. It was viewed as a negative trial. There were fewer deaths from breast cancer as well. That also was not significant. And so then we thought that the study might become positive with longer follow-up, but what happened is we saw that after the intervention ended and all contact with the nutritionist ended, women started to not adhere to the diet, and the trend was lost. So then what happened was I had the concept that perhaps, based on the original findings, that maybe we were reducing breast cancers, especially those associated with a bad prognosis. So this analysis is looking at that same population, but focusing on the 1,767 women who had breast cancer either in the control or diet group that were diagnosed during the dietary intervention. We looked at two ways. One way was looking just at what happened at 8.3 years, and in that group, deaths from breast cancer were 32% less. That was borderline statistically significant. Deaths after breast cancer was 35% less. That was statistically significant. And then we looked at, starting at the time of diagnosis, in the 1,767 cases, and women in the dietary group had 20% fewer breast cancers. That was statistically significant, 0.02, 82% versus 78% alive at 10 years, and that 4% difference is bigger than aromatase inhibitors added to tamoxifen. It's bigger than taxanes added to non-taxane therapy. So it's a secondary analysis, but it's of our primary endpoint, and we think it will change the perception of the influence of a low-fat diet. Yeah, I think the take-home message is even though we weren't studying weight, there's a number of ways, there's many reasons why weight maintenance is important. You can get there a number of ways, either kind of low carbohydrate or low fat. There's competing diets. So it seems like if you're interested in breast cancer, we have evidence that maybe the low fat diet might be a better way to go.